But Franklin, you're listening to Source of Information, the only place where you could get information regarding Medicare, Medicaid, food stamp, low income subsidies, and all those good benefits that offers by Social Security. Today, we go and concentrate on the new people that's coming into Social Security. I'm talking about those of you that's at the age of 59 that just turned 65 or about to turn 65. So we're going to talk a little bit about that, the advantage of having a Medicare card and as opposed to not having it. If you don't have it, then you at the age that you should be having it, and you don't have it, you will sense or feel the impact of not having it. And we're gonna explain to you how you come about to getting Social Security and retirement benefits. So we're gonna start from the beginning. And I know that those of you who are just going through that process may find that process a bit challenging, is the word, for lack of a better word. And it's probably was done purposely so that it seems challenging for you. The line is already open. So meanwhile, if you have any questions for us, you could reach me at 305-945-1580, 305-945-1580. Hopefully I am on air since I do not see. Um, Hopefully we are broadcasting live. Okay. Nevertheless, let me take a quick break, making sure that we are streaming live on YouTube and Facebook as normally on this day. Yes. So we were talking about those of you who are just about to apply for retirement benefits, such as Social Security retirement benefits and Medicare. Ooh. First and foremost, let's discuss how you come to that point to be eligible to receive retirement benefits and Social Security benefits. When this law was created, it was created for an individual that's working and contributing to Social Security. And the way the contribution is done is by an automatic withdrawal from your paycheck every time you get paid. If it's biweekly, every 2 weeks, a certain amount is taken away from your paycheck and sent to Social Security. And you will, if you check your pay stub, a lot of us don't get pay stub anymore. In the olden days, you used to get a paper stub with you used to get your check, a paper check, and also it has the whole stub in the back of it to detail exactly each amount they take from you. Where is it going? For example, you see federal income tax. You see in certain state that collect state taxes, and you'll see Social Security, and you'll see Medicare. And for those of you that 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 allow them to take, if you're getting certain benefits like health insurance through your job, you see details of how much they take for each, whether it's health and you're adding life in there also, um, and a portion of that is paid by you, and a portion of that is paid by your employer. So that amount is taken from you every time you get paid, and after 10 years of working, you would have accumulated 40 quarters. In order for you to be eligible for these benefits, you have to have accumulated 40 quarters. And for each year you work, you have accumulate 4 quarter. So in a period of 10 years would is sufficient for you to accumulate your 40 quarters. Now, even if you're skipping job, and if you were consistently a whole year, then you would have accumulate your 4 quarters for that particular year. Now, at any given time, feel free to call 305-945-1580, 305-945-1580. That's the number to call right now if you have any question for me. So 40 quarters is the target point that we have to accumulate in order for us to be eligible to receive Social Security and Medicare benefits. Now, we're going to stick to, we'll talk about our spouses later that did not work and how they come about to receive benefits. We'll talk about that a little bit later. But for now, we're going to stick to those of you that's receiving benefits based on your own earning. After you receive the 40 quarters, then you have to wait till you reach the retirement age. Retirement age for early retirement age starts at age 62. And for some of you, full retirement age is 66 and 8 months or 10 months. And those of you that was born in 1958, it's 66 and 8 months. And 1959 is 66 and 10 months. And everyone who was born after that, starting from 1960 and up, your full retirement age is 67. Now, full retirement age is 67. And we'll get in a little bit, we'll get about the pros and the cons about getting early retirements versus full retirement. We'll get into that in a bit, probably the second half of the show, and in a much greater details. So once you establish that, first of all, 65, you must apply for Medicare. Because if you don't apply for Medicare at the age of 65, you're going to be penalized. How we avoid from being penalized, that's what we're going to discuss now. So let's say you decide to take your retirement benefits let's use the first scenario. You decide to take early retirement, whether it's let's say it's you decide to take it at age 65. So when you decide when we fill out the application for you, that same application is an application for your retirement benefits and Medicare. There's questions in there that would ask are you applying for Medicare only? And normally we click no on that. And we'll let them know that. And the next question is, are you applying for retirement benefits also? And the answer to that question is yes. So once we click yes, the next question will, are you applying for Part B in Medicare? And the answer is yes. So all this application must be done 3 days ahead of time. I'm sorry, 3 months ahead of time. The reason for putting that application in 3 months ahead of time, and 3 months from your birthday year. Your eligibility month is your birthday month when you turn 65. Now, you're going to hear some people will tell you that it's 3 months before or 3 months after. And my response to that is, I don't talk about 3 months after. Because when you're talking about something as important as healthcare, and the vast majority of you probably, especially the guys, you probably didn't go to your doctor as often as you should. And it's not really your fault, but financially, you weren't in a position to do so. In some cases, our wives are the one that's pushing us to go get a checkup. Go get a checkup. And if you don't have a wife, oh, by the way, today is Valentine's Day. I want to wish all the ladies a happy Valentine's Day, full of love and flowers and chocolates. So a lot of us did not go see our doctors as often as we should. So when we get to that point at the age of 65, you have Medicare. The very first thing that you should be doing as soon you have that Medicare is make sure you see your doctor, get a complete checkup, check your prostate, do a lab that's going to check your sugar level. There's a exam that's called hemoglobin A1C. That's going to check your sugar level for the past 6 months. So all this must be done within that first visit and that first month. So consider that a birthday gift that you're going to give to yourself. And hopefully that you've been exercising, you've been maintaining yourself, although you didn't make a frequent visit to the doctor, but you've been eating properly, you've been drinking a lot of liquid, you've been keeping yourself hydrated. You've done all those stuff so that keeps you healthy. And hopefully when you sit down and have that complete checkup with your doctor, it says, well, everything is fine. That's the best case scenario. Everything is fine. And I'll see you in a few months. The best thing about the part about the health insurance, the Medicare, and of course you have to put a Medicare Advantage plan with it. I know from state to state, the Medicare Advantage plan differs. One of the issues that I know in New York is completely different than down here in South Florida. One thing that I was talking to some colleague over the weekend, and one thing I was telling them that I wish that the same model that we have in South Florida would be adopted nationwide, because then we wouldn't have to worry about a portion of the country do not have dental, do not have hearing or optometry. So all that will be under the Medicare Advantage plan will be there available for you. Now, is it challenging? Yes, it is challenging. But the most important part is that you have those benefits. Now, once we put that application for you, of course, there's a process that they go through to verify your information. First of all, to make sure that you are eligible, and the only eligibility requirement is that you have 40 quarters. One of the things that I always suggest is that your tax information, that you keep it from year to year. So in the event, and it's very rarely happen. Probably mostly, the information they have in Social Security is very accurate. Thus far, that I could see. But there's something else you could do when you are getting close to that time. You could go on the website ssa.gov and click on My Account, and you could open an account, provide your information, your Social Security number. Of course, they're going to need an email to probably send you information, and then they're going to verify everything. I'm sorry. They're going to verify your information. If the information that they have in their system corresponds with the information that you provided, then they'll open an account for you. Now you're able to see your contribution from the age of, if you decided to take early retirement from 62 to 65, in certain cases to 66, exact amount of money that potentially you'll be receiving. And it would tell you that if you're eligible, or will you be eligible at 65 for those benefits. Now, we'll go back a little bit for Medicare, because I feel it's necessary for a lot of you guys to get this information. Once you decided, okay, I am going to file for Medicare. First of all, 65 Medicare, you have to. But some of you guys probably going to continue to work beyond 65. So you may say, well, because of the Part B premium that they're going to take from my Social Security, or if I'm going to wait for full retirement, I don't want that money to come out of my paycheck, or that I have to send them a check every 3 months to pay for that premium. I am not going to apply for Medicare. Wrong way to go about it. Remember, Medicare have different parts. The parts we're going to concentrate on is A, B, C, and D. Okay? A is for hospitalization. B is for doctor's visit. C is for Medicare Advantage plan. And D, which I think the vast majority of you may know about D, because you hear so much about it in the media. So Part D is for prescription drugs. Part A now, that's the money that they've been taking from you throughout the last 10 plus years. Okay? As long as you are working, they take something from Medicare and it goes towards your Part A, hospitalization. Now, Part B, on the other hand, is when you decide to apply for Medicare, and once you're eligible, they will start taking that money at that time. Now, it varies for different people. Anybody who's making a certain level of income, your Part B premium is going to be higher. That's why I could never understand the logic about certain income level, and I'm not going to criticize too much, because if God bless me, when that time comes, I'll probably be in that same area of some of those people. and having to make a decision whether I'm going to go. I know definitely I'm going to go with a Medicare Advantage plan because there's certain benefits, even though I may not be getting a full benefit as a SNP person, a special need person, but the benefits will be far better than if I were to get, in comparison to any insurance that I could get from a job for my job, or a supplemental benefit, because the supplemental benefits, and a lot of you guys that's about to retire now at the age of 65 or take full retirement age, you're thinking about, wait a minute, let me go with a supplemental. Well, that's where you're going to make a mistake, because the supplemental you're paying for a supplemental. Now you're paying for a premium Part B. Your premium Part B is going to be higher than the average American because of your income. Somebody who's making a hundred thousand plus, there's a certain threshold. I believe the income limit was 168. So your Part B premium is going to be higher than most. So you're paying a higher Part B premium. You're going to pay for that supplemental, and the supplemental is going to cost you, I would say, around $400 a month. As you get older, that amount increased. I had a friend that recently, she was in town, and we were talking about the increase, the 3.2% increase that everybody received. And she was telling me, "Well, I don't see it." I'm going, "Well, you should see it." So it's fair to say that she may not have seen it, because what happened is that, remember, when they give you an increase, so they also increase the premium for the Part B premium. So for certain people in a certain income bracket, the increase for the Part B premium is higher than most. So the 3% increase that they gave you, you don't see it, because it really comes they give it to you on the left hand, and somebody's pulling it out on the right hand. So in certain cases, it might not even be a wash. You may see a reduction on your pay. But the average American, most likely that's, this year, the baby boomers that enter retirement this year, the average income is about $3,800 a month. So we are about to depart from. You're going to find a vast majority of Americans that are retiring, the baby boomers. Yes, the Social Security income is going to be in the 3,000 area. And of course, as you work, that amount continue to increase. So if you were to stop working at the age of 65, then you're not contributing. Whatever you had worked for, that's what for the past 35 years, that's what they're going to base your income on. That's what the metric they're going to utilize to figure how much you're going to be receiving on a monthly basis. 305-945-1580, 305-945-1580. We're going to continue because the information is flowing, and I don't want to stop. So you are, yes, the average of baby boomers that's coming in, 3,800. That's how much you're going to be receiving. Like I was saying, that the past 35 years, that amount you were receiving is going to be taken into consideration how much you will be receiving on a monthly basis. And of course, if you continue to work at the age of 70, it keep increasing from year to year, because remember, right now, if you receive, if you get a statement, that statement gives you a certain amount. It's basing on an assumption that your income is not going to increase, it's going to stay the same. That's what the assumption is basing on. When from year to year, you will most likely see a difference in your income. 305-945-1580, 305-945-1580. Give us a call. So Medicare is the way to go, and it will cover you from head to toe. Those of you that's in South Florida, by far you will find that it is far much better than a supplemental benefits that's going to be sold to you. And you will find out that, yes, you have more money coming out of your pocket with the supplemental, as opposed if you have a Medicare Advantage plan. The Medicare Advantage plan will cover you from head to toe. The only amount that's going to be coming out of your Social Security check is the Part B premium. Okay? Now, let's take the individual that has still have an apartment in New York, but I have a house down here in South Florida. So during the winter time, they are down here, and during the summertime, they go back to New York. Their concern is, while I'm in New York, if I need to see a doctor, what do I do? And the answer is easy. Now the market is going. I thought that it would head toward HM, have at least a plan for PPOs. But I don't think that the big guys, such as Humanas, will continue with the PPO because it's not going to be profitable to some of the medical centers. They may still carry it. Again, my guess is that with the way the market is going right now, even if they offer it, the co-payment will be much higher. So let's say they continue to offer it. And again, it's not beneficial for the centers. Yes, it's beneficial to the patient. It's not even beneficial to the health plan. So you could get a PPO. So the PPO would allow you to, when you're up north, to go to any doctor without needing a referral. Any doctor that takes that particular health plan insurance. So you could see the doctor, and they will bill. The doctor will bill the health plan directly, and they would get paid through that. So when you come back down here, you'll have a doctor down here. You could go to that doctor without any issue. Your other option is this. Let's say, for example, you don't want, when you weigh the options of having a PPO versus having an HMO plan, when you weigh the two options, you realize that, wait a minute, having a straight HMO is going to cost me less than having a PPO. So your other option is, I'll get the HMO, but if I reach a point that I'm not feeling well, I know I cannot go to a doctor, but I could go to an urgent care. You go to the urgent care will see you, they'll bill the insurance company, and they'll do all the work that the hospital would have done at a less cost. Because see, when you go to the hospital, and I don't have all the breakdown on the billing in the hospital because they I believe they charge a fee for stocking certain items there. Of course, the price of the service is through the roof. That's something totally different. So it's better to go to an urgent care. The urgent care bill is less, and they're able to prescribe medication for you, and you could go pick up that medication from a nearby pharmacy. Now, let's go back a little bit. Remember, I said 3 months before. You want to have all this done 3 months before because God forbid that same month that you need to go see a doctor, then you have everything in place. You could go see your doctor and without any issue. Now, if you decided when you reach the age of 65, you're going to wait for full retirement age, then at that point, what you can do is apply for Medicare Part A only. I said Medicare Part A only because remember, the Part A is already paid for. Part A is already paid for. The part that's not paid for is Part B. So what you will do in that case is apply for Part A. When you are going to apply for your full retirement age benefit, then in that same application, they could apply for Part B for you. Now, providing that at the age of 65, you have another insurance there available for you, which means that you have an insurance, you're going to continue to work till full retirement age, you maintain your insurance, your health insurance that you have to your job, not Obamacare. The health insurance that you have to your job, you maintain that. And upon filing for Medicare Part A, one of the questions they're going to ask, do you have current coverage from your job? And if you said no, then they will break it down to you what's the regulation is. But that's one of the questions they're going to ask you if you have. Let's say you do have it, and we'll put that information. When did it start? When did it end? It's still active. We click it's still active. So when you go back at full retirement and filing for that information, all that information, they already have it in the system. Your insurance information. So we don't have to go, well, the fact that you didn't have any insurance, now when it comes time for you to get the Part B, you're not eligible for it because you didn't have active coverage at that time. So we wanted to avoid that, to make sure you have active coverage when that time comes. That's why the information we're providing to you is very, very important. So you apply for Part B, and when you reach your full retirement age, then you apply for Part A. When you reach full retirement age, then you apply for Part B. Now you have Medicare Part A and Part B at the time of full retirement age. They will send you another card. Remember, when you apply for Part A, they sent you a card. That card said hospitalization only. And the effective date, they'll have the effective date there for you. Part B, when you apply for Part B and they send you your card, it will have a different date on it than Part A. Also, a long time ago, not so long, but it seems like it's been a long time. And a few years ago, they decided to remove your Social Security number in the front of the Medicare card and insert a computer. I guess a computer generated ID for you. So that particular computer generated numbers and letters, it's only for you. Just like it's going to replace your Social Security number. So a lot of you will receive it since you weren't receiving benefits back then. You may not even notice it. But I say this for those of you who has a card that has your Social Security number in the front of it, then that card is best that you keep it at home, somewhere safe, and don't walk with it, because anybody who comes encounter with that card and find your Social Security number and have a bad intention in mind, then they could take that and the sky's the limit what they could accomplish with it. So if you have a card like that, you want to keep it at home, stay away. If you have your parents, and you're looking for on their cards, it has their Social Security number in front of it, then take that card from them, store it away. Don't walk with them. Don't walk with it. So the card will have a bunch of letters and a few numbers that would represent your once they put that information in, all your information will pop up. Who's your primary insurance? Who's your secondary? Some of you guys may have a third, which will be Medicaid. Okay? So once you have all this in place, and the things that I like at CareMax is that when you come in, especially my center in Plantation, when you come in there, we make sure that we covers everything for you. And what I mean by that is we'll sit down and find out what's your status. And what I mean by what's your status, in terms of potentially what benefits will you be eligible for. And it's very easy by simply asking you one simple question. How much do you get from Social Security? Over the yesterday, I went up to Orlando. I was in Orlando Monday afternoon and came back last night. And a childhood friend, family member, I sat across from him, and I asked him. We were talking about, he was asking me a question about that, and then we mentioned about the Social Security number, Social Security benefits, Social Security income benefits, and then his wife said, "Oh, he's getting more. He's getting a pension." So a lot of you, especially those of you that work for the city or the state, or those of you who at one point was living in up north and worked over 10 years in a particular job, you will have a pension. When you take in consideration the amount you're getting from the pension, the amount of Social Security, most likely that benefits like Medicaid, you will not be eligible for. And that's also going to affect your spouse, because nowadays the fact that everything is related, once they put your social security number in the system, then your wife also is going to pop up. So that's something to take in consideration, and that's not much you could do. There's certain cases where a spouse is making a certain amount, and the other spouse is making less. In this case, once we put in the, once when we input in the application in the system, they also ask for your spouse information, so that the person that's putting the information in the system that's going to process it have options for you. They could say, well, instead of this person receiving benefits based on their own earning, well, it's not enough. Then we could utilize the spousal benefits so that to bring this person up to 50% of the spouse, the other spouse that's making a higher 50% of their earning, without anything coming from they or interrupt their earning what they're supposed to be getting on a monthly basis. They will continue to get the same amount, but they're going to calculate 50% of that, how much it will be, and then the spouse will be receiving that. So that's a one case scenario where they could eliminate the amount of the spouse is getting if it's not high enough, and say, well, why don't we give spousal benefits? It's higher, and the income will be there. So, it's a great benefit. Let's say this. Let's give it its due. So that's one aspect, and that's one of the reason why you definitely need to do it 3 months before, because you give the person that's processing your information time enough to weigh all your options and come with a decision that's in your benefits. 305-945-1580, 305-945-1580. Give us a call. Give me a call. Let me know what you're thinking. Let me hear your questions. We don't have much time left. And I happen to talk throughout the break. And so let me hear you. 305-945-1580, 305-945-1580. Let me also thank those of you who made the trip on Saturday to help us celebrate the inauguration of Camax Medical Center of Plantation. It was a great event. We had fun. I believe we did a good job in thanking those people that responsible, the individuals that responsible for Camax Medical Center of Broward and Plantation in particular to be the center that it is right now. So we thank everyone that came by, and we truly appreciate you guys. And we're going to continue to provide the type of service that allow you to stay with us all these years and made Death Center your home. So we thank you. Big applaud for you, those of you that's been a member for a long time. And sometimes you guys come across and say, Gilbert, I've been a member. I've been with you for 16 years now, 16, 17 years. I appreciate that, and I thank you for being loyal members. And we look forward for an additional 15, 16 years. And even if others that come in and replace you, but we'll continue this legacy and continue to provide you with the best care. Of course, at one point, I'm going to have to take my retirement, which probably when I reach 70. 75. I keep pushing it up, but God's willing, He will let me know when it's time to step down, travel, and start taking it easy a bit. 305-945-1580, 305-945-1580. Let me hear you with your questions. And even if it's in Creole, I'll translate for you. So 305-945-1580. We have roughly about 5 minutes left for this show. And source of information is going to come back in the next hour. With the Creole version. So stay put. Today we're going to have a great discussion about hypertension. So stay put. Again, if you have any question regarding what we discussed today, 305-945-1580, 305-945-1580. It's interesting. So some of you guys have said to me that you've been trying to get through. You had a hard time to get through. And I could understand, especially the second hour, when we come on with a lot of phone calls that's coming in as the doctor's talking. We may not get to you as fast, but we will get to your questions. Okay. So we'll continue back with the information. We're about 3 more minutes that we have. So you see. And like I said, it's best that 3 months before that you apply for all your benefits. Don't listen to anybody that tell you that you could wait 3 months after. And don't make the mistake and do not make times for you to apply for those benefits. It's only going to, if you come to me, yes, you're going to have to make certain sacrifice, because please don't ask me about Saturdays. Schedule, because I don't work Saturdays, I don't work Sundays. But during the week, we could make a time, and the application only take 15 minutes. So literally, I could sit down on a Thursday and schedule appointments and throughout the day and get you in and out, get the next person in and out, in no time. 15 minutes, and while 15 minutes, we're talking, we're having fun, it gets you out. The best part is, I don't charge you. I don't charge you because I reserve it so that you could see the value of what you just received. And also, if you happen to like the center, a state-of-the-art center, then you'll decide, well, I'll stick around. You could always reach me at 954-667-4885, 954-667-4885. To call me, set up an appointment, and I'll be more than happy to help you in your decision making, when to take, whether you should take early retirement, whether you shouldn't. I'll advise you, but the final decision is yours to make. And of course, as I said on the air before, I used to advise people, basically I couldn't advise you about taking an early retirement. Some of you used to come to me and say, well, I want to take it early. And now if you come to me and tell me you want to take it early, based on my experience over the years, some people that I applied for came back and said, I wish I didn't take it, because the amount of money that I'm receiving is very low. Those of you who decide to take early retirement, especially at the age of 62, you're going to receive roughly about 70% of that benefits. And even right now, 65 is considered early retirement. So full retirement age for a lot of you guys, 66 and 10 months, or 67 for those of you that was born in 1960 and up. So there's a lot of decision for you to make, but make a wise decision. Whether you're listening to me via Facebook Live or YouTube, First of all, remember to subscribe so that you could get this show every week. And once you get it, weigh the information. One thing I will promise you guys, I will try to get this show on a different platform of social media, because I think this particular one was very important for you guys to have, especially some of my friends that's considering early retirements, because you guys have been working a long time. Again, my name is Gilbert Franklin. You could always reach me at 954-667-4885, 954-667-4885. I love you guys. Happy Valentine's Day to you beautiful ladies.